There is nothing either good or bad, but thinking makes it so. The management of glucagon-like peptide 1, GLP-1, and glucose-dependent insulinotropic polypeptide, GIP, agonists before endoscopic procedures remains unclear, with uncertain risks of retained gastric contents. This trial aimed to compare risks of residual gastric volume, RGV, in patients who either continued or held their GLP-1 GIP agonists prior to sedation. Conducted as a randomized single-mask trial at 2 major U.S. centers, this study included patients aged 18 and above, already on a stable dose for over a month. Excluding those with certain gastrointestinal conditions, patients were randomized to either continue or hold 1 dose of their medication. The primary outcome was the occurrence of clinically significant RGV during upper endoscopy.
Quick take. GLP-1 GIP agonists periprocedural management is understudied, so this trial compared the effects of holding versus continuing the dose before upper endoscopy.
In the interim analysis of 60 patients, significant RGV was 3.1% in the hold group versus 25.0% in the continue group, a notable absolute difference. Subgroup analysis showed a higher RGV risk for those continuing the medication among those undergoing only endoscopy. In contrast, no significant RGV was observed for patients on clear liquids the day before the procedure. The authors conclude that stopping GLP-1 or GIP agonists reduces the risk of significant RGV, but the use of clear liquids may help mitigate risks regardless of medication use.
Quick take. The trial demonstrated a higher significant RGV risk with continued GLP-1 or GIP agonists, suggesting benefits in holding the dose before endoscopy.
Short quiz, clinical vignette. Question. A 62-year-old woman scheduled for upper endoscopy is on a stable dose of GLP-1 agonist. Recent labs show a normal gastric emptying study. Should she hold her medication? Option A is yes, holding reduces the risk of significant RGV. Option B is no, continuing has no effect on RGV risk. Option C is yes, but only if combined with other medications. Option D is no, the medication should only be held if gastroparesis is present.
The answer is option A. Holding the GLP-1 agonist decreases the risk of significant residual gastric volume during upper endoscopy.